guys, it's Dr. Jim. I am your pregnancy chiropractor and your natural health care expert, and I want to welcome you to this pregnancy and chiropractic video. Today's topic, really important to me. It's probably how I got my start in seeing so many awesome pregnant patients. We're going to talk about breech babies. So, what happens and how does chiropractic help when your baby may be breech? Now, obviously, in order for the baby to come out the right way, it needs to be head down. And oftentimes as we get further along in pregnancy, either your doula, your midwife, or your doctor will tell you, hey, your baby's head is not down. And that's your baby's breech. And, so we do in our office, and this is how I blew up in pregnancy chiropractic, is because someone, really one of the great midwives in our town, sent me somebody, and their baby was breech, and we worked on them, and their baby turned. And then they sent me another one, and their baby turned. And then basically that's how I became sort of the pregnancy chiropractor. And so there's something that we do in our office called the breech turn technique, okay? And what I want people to understand, if you come in and your baby is head up or it's posterior, it's just not an ideal position, okay? What we do is, I want you first to understand, I don't physically touch your baby, we don't move your baby, I don't put my hands on your baby. But basically, the reason why babies don't get where they're supposed to do is because there are interferences. And those interferences are often connected to a misaligned pelvis and then a tightness in the round ligament, the abdominal muscle on the opposite side. And so what I do is, I don't physically move babies, I just remove those interferences, and we use some specialty techniques to do that, very gentle, very light. And when we remove that interference, it allows babies to go where they want to go. So there's no trauma to you, there's no trauma to the baby, it's very non-invasive, and we have a very, very high success rate of babies turning, which is awesome. And so if your baby's not in the right position, maybe it's posterior, maybe it's breech, then definitely a chiropractor like myself who does the breech turn technique or works with pregnant women sees this a lot, and we'll work on it, and typically within a couple of visits the baby will turn. Now, if the baby doesn't turn, there's usually a very specific reason. It's not to the baby's advantage to get head down. Maybe a cord is wrapped around somewhere, and if the baby got head down, it would be a problem for the baby. So if we remove interferences, babies tend to get head down. If they don't, there's probably a good reason for it. So definitely like this and share this. Get this out into the pregnancy community. If you're local, definitely come see me while you're pregnant. If you're in a different state, find someone local or reach out to me, and I'll help try to find you someone local that does this kind of work and can help you out, all right? So just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit, and I believe that God wants the very, very best for you, and the day you believe that, change your life forever. Have an awesome, awesome day.